Let's face it, medicine has never been easy, and you probably don't even want it to be. The challenge is one of the reasons that you applied to medical school in the first place. And it's likely one of the motivators that gets you out of bed in the morning after a really hard day. You want to prove to yourself and to everyone else that you're up to the task. But in 2025, it's more complicated, more exhausting, and in many ways, more isolating than ever before to work in healthcare and to be a physician. You entered the field of medicine wanting to make a difference, to help people, to feel purpose, and to make a living. But somewhere along the way, you've started to wonder, is this even worth it? Is it sustainable? Do I have to feel lousy and burned out to be a good doctor? Am I allowed to want more than just my medical career? If you've asked yourself any of those questions, you are not alone. And more importantly, you're not broken. The healthcare system is. You've learned how to take care of others, and somewhere along the way, you learned that taking care of yourself was a luxury and a sign of weakness. So, you stopped. And now, you can't find a way back, and you're miserable and looking for a way out. It is time to fix that. It is possible to do hard things, to challenge yourself, and to take care of yourself while making a living. In this video, I'm going to teach you how, and introduce you to a tool that's used by professional athletes, actors, CEOs, and your favorite musicians that for some reason, physicians look down upon and rarely utilize. What is that tool? Coaching. Hi, I'm Dr. Ben. I'm a pediatric cardiologist and physician coach. I've worked with countless doctors who love being physicians, but can't see a sustainable path forward and are ready to leave. I've seen friends, colleagues, and more importantly myself, hit a wall in practice, and they prepare to blow up their lives by giving up the skills they generated in medical training. For a long time, I thought that being a doctor meant constant sacrifice and misery, until I realized that there was another path forward. I found that path through coaching, and as a result, became a coach myself so that I could help others. I've helped hundreds of physicians create lives and career they love through coaching. So that leads to the question, what is physician coaching? Well, let me start by telling you what it's not. Physician coaching is not therapy. It is not mentoring. It is not someone handing you a life plan in a tiny binder. It's not punishment. It feels a little squishy, but it's not made up. It is evidence-based. Coaching is a partnership. It's a conversation that helps you move forward. It's a space where you get to ask, explore, reimagine, and take action to build the life and the career that you want. So whether you're a medical student trying to find your path, an early career physician who's adjusting to the weight of a job, or a seasoned doctor who's asking, what's next? Coaching will help you realign your work with your values. It helps you show up better at work and feel more like yourself at home. Let's take a minute and talk numbers. Over the past year, 60% of physicians have reported symptoms of burnout. That's 6 out of 10 physicians. That's not just frustrating, it's dangerous for patients, for families, and for us. Meanwhile, we work in a healthcare environment that is changing so quickly. AI, corporate consolidation, productivity quotas, and broken reimbursement systems. We're being asked to do more with less and for less, and often are made to feel less. Less joy, less impact, less control. Coaching helps you push back against the pressure by building emotional clarity, mental agility, non-clinical skills like negotiation, and boundaries that actually protect you. Let me tell you something that no one told us in training. Being a great doctor isn't just about medical knowledge or clinical skills. It's about communication, empathy and emotional regulation, conflict resolution, time management, and leadership. You know, all of those skills that nobody tested you on in medical school, but you rely upon every day, and to be honest, are probably lacking. They're the things that you fake it until you make it, or you crash and burn, or get written up for unprofessional behavior. These soft skills are now survival skills. They're the difference between a chaotic day and a miserable career and a connected day and a great career, between leading and burnout or leading with purpose. So through coaching, you'll learn to navigate high-stakes conversations without emotional fallout or losing your cool. You'll learn how to build trust with patients, which you already do well, and your team. And you'll learn how to reflect on what matters most and to make aligned career decisions so that your work and life are in harmony. So let me give you a few examples about some physicians that I've worked with over the last few years. First is a pediatrician who's on the brink of quitting, and she found space to explore a hybrid role. She's now seeing patients part-time and writing health education content. Now she's re-energized and is excited about medicine. Her creativity is back, and her patients benefit from her joy. She also sees her kids more and is just in general more happy in her life. Then there's a surgical resident who was overwhelmed by imposter syndrome and was ready to quit. who learned how to lead from authenticity. He stopped trying to be perfect and hide his questions and started showing up as himself. That's when everything changed. It changed how he trained, how he taught, how he felt about himself, and how his instructors perceived him. Or there's the hospitalist who was unsure about staying in clinical medicine, and he worked with a coach to explore non-clinical careers for physicians. He discovered that his true strength was leading systems change. He still works part-time in the clinical setting on the hospitalist floor, but now he's helping shape policy at the organizational level, and his career's reinvigorated. What's the common thread? They didn't just need a break. They needed a mirror, and coaching gave them that reflection and a roadmap forward to build sustainable, fulfilling lives and careers. A lot of doctors think, I'll try coaching when things get bad enough, or I'm not in trouble, why would I work with a coach? But the truth is, the earlier you start, the better. Coaching isn't just for burnout recovery, it's for burnout prevention. It's not really a lifeline or a punishment, it's a launch pad to build your career. Do athletes fire their coaches when they make it to the pros? Do professional musicians stop working with vocal coaches? Do Fortune 500 CEOs stop developing their leadership skills? No, of course not. That would be ridiculous. So why do physicians resist a tool that works? Think of it like preventive care for your career. Regular check-ins with someone who's trained to help you grow, stay grounded, listen, act as a sounding board, and make intentional decisions. It's about turning your career into a calling. One that doesn't cost you your joy, your relationships, your sanity, or your health. So, how do you get started? I'll give you a few ideas. First, look for a coach. Make sure you look for one that understands the medical world. At The Developing Doctor, I combine lived experience in clinical medicine with evidence-based coaching practices. I'm not just a coach. I'm a practicing physician. I work in the same system you do. I'm also a member of the International Coaching Federation and a certified physician development coach who undergoes regular coach training and refreshments. That means I know how to use Epic. I understand the struggle of managing your in-basket after hours at home in your pajamas. You won't need to explain the ins and outs of your day to me because I work in the same system that you do and I understand many of the same stressors. I also happen to be trained to support you as a coach. So what do we do in coaching sessions? We focus on you, your goals, your strengths, your blind spots, your needs. It's all about the client. Together we build clarity, confidence, and action plans that move you forward. So whether you're seeking more balance, new skills, a career shift, or just a place to breathe and think, you belong in coaching. You don't have to do this alone. Medicine doesn't have to be isolating. If you're feeling stuck, it doesn't mean that you failed. If you're craving more than clinical work, it doesn't make you ungrateful. And if you want a life where your identity as a doctor fits inside your identity as a whole person rather than the other way around, that's not selfish, that's sustainable. Coaching isn't a luxury in 2025. It's a necessity for the physicians who want to not just survive, but to thrive. So here's my invitation to you. Let's talk. As I said, I'm Dr. Ben Reinking. I'm a board-certified pediatrician, board-certified pediatric cardiologist, medical educator, and master-certified physician development coach. And if this message resonates with you, check out my website, thedevelopingdoctor.com, or you can use the link below to book a free coaching consultation, or explore my online self-paced coaching program, Mastering Wellness, How to Thrive as a Physician. There's also a link in the comments and on my website. You became a doctor to help others. Now it's time to help yourself. I look forward to hearing from you.